Well, I grew up here, so we rode horses quite often, almost daily. Hiked the mountains, which led to painful knees. I actually had bone on bone, and it just kept getting worse with arthritis. Well, kind of interesting, my threshold, I took care of my dad, who was wheelchair bound, walker, had to lift him in and out of the car, out of the bed. And it just wasn't feasible to do it. We finally got him into a home, and I figured I better take the time when I could. Got to the point where I couldn't hike anymore, couldn't do normal daily chores, and I'm very active. I ride bikes, I run, and when I couldn't do that anymore, I figured it was probably time. I read a bunch, the new procedure, Navio, had a couple of other friends who had had their procedure done, and I was very impressed with the recovery time, which is important to me since I take care of my son and I'm active and I wanted to get back out. And I stumbled upon the Phoenix Spine and Joint, read up on it, went and visited the facility and was incredibly impressed with, well, the waiting room, number one, the staff. But going back into the surgical area, it was very intimate. You had one nurse, taking care of maximum 2 patients. You could just tell it was a very sterile environment. Not only that, everybody had great personalities and they all worked together well. It was comfortable. There was no doubt in my mind where I was going to have my surgery done.
Currently, I'm using Navio for almost 100% of my knee surgeries. And the reason I'm using it is because it's a really powerful tool. It gives you a lot of things that you can do with it. The goal of the robotic platforms has always been to make the surgery more reliable. So we're not sitting here saying, looks close enough, let's do that. We're actually using the technology that we have available and to allow us to do the surgery in a more elegant fashion. And what we're seeing is that we're offloading a lot of the things that we otherwise would be doing in physical therapy. Because historically, we would get the alignment right, say, oh, it's pretty darn close, and then you would have to therapy through it to make it work better for you. Now, we can actually measure exactly how your knee is working during the surgery. We can make fine adjustments to the overall mechanics of how things are going, everything from sizing to rotation to even pressures. And in doing so, we can pretty much predict how that patient is going to do with therapy. And we can really decrease the impetus or the load on the patient to kind of get better, because they don't have to push nearly as hard to get similar results. And that's really the goal of robotics, is to make the entire surgical procedure more elegant. And we're doing a lot of things here that are not just based on the robot. We're using alternative anesthesias, which means that we don't have to gas your lungs, we don't have to intubate for you, we're not breathing for you during surgery. There's less medication overall. Patients get REM sleep during surgery and actually are not nauseated and more alert afterwards. But then there's other things. This is not the first knee surgery or hip surgery that I've done. There's thousands ahead of them. So you learn from every case you do. So that feedback mechanism is important also. So in order to get patients to feel better, some of this is simply proactive. That makes for a much better clinical and post-operative experience for the patient. It also makes for a safer experience for the patient.
If you want the best, you have to go to an environment where only the best is done, and that's what we do here. We're looking for people who are delivering the very best care in the very best way using the very best technology. Our concept is that if we take the best doctors and arm them with the best technology and put them in the best system, that the care that they are going to deliver has got to be the best. And that's what we're doing here.
There is literally, I have no pain. I had full range of motion in about 6 weeks. And now I can do pretty much anything, pain-free. I'm back full. I'm hiking, I'm biking. Really, there's no limit. It feels, it's amazing. If you want personal care, if you want, a sterile, friendly environment with truly, one-on-one, there's no other choice. Phoenix Spine and Joint is amazing.